Hello, and welcome to podcast number 3 from the University of Cumbria and the AP programme, or Assistant Practitioner programme if you want the full title. Spring is here, so we're going to showcase some of the students' work in this edition, where they interview their chief executive for an assessment. The assessment is for our leadership, management and quality module. I'm just going to introduce the people who are with me, which is Fiona Parkinson.
Hi, I'm Fiona. I'm a lecturer on the Assistant Practitioner programme. I've got a degree in health and social care, but I am an assistant practitioner by background. I worked in practice as an assistant practitioner before working at the University of Cumbria.
And also Steph is here today. Steph Edwards. Go for it, Steph.
Hi, I'm Steph, so I'm also a lecturer on the AP team at the University of Cumbria.
Thanks very much. So the assessment is a podcast where the students interview their chief executive and then do a commentary on what the chief executive has said. And the snippets you're going to hear will be some of the answers the chief executives gave and also some of the commentary the students did. It's gone down well internally and externally, both with the Institute of Health here and also with our students and employers. This is a kind of assessment which is called an authentic assessment. It's part of our learning, teaching and assessment plan at the university to get more and more of these kind of assessments in, where we really listen to the student's voice. And one of the best things about it is it develops the student's academic voice. So we really hear, for the first time in many cases, students really starting to talk about their thoughts and feelings and ideas about things, which is fantastic. It's basically part of the AP standards. So some of the standards, Skills 17 and Knowledge 17, are around promoting the use of digital solutions to improve communication systems and practices, which is one of the reasons we use podcasts. But if you look at the HCPC standards, it's around using information, communication and digital technologies appropriate to your practice, understanding the qualities, behaviours and benefits of leadership, recognising that leadership is a skill all professionals can demonstrate, and identifying leadership qualities, behaviours and approaches. So I think it's really important that we have something that really starts to go to the heart of leadership when they're interviewing their chief executives. So understanding senior leaders is really important and their model of leadership. And that's why we do this as an assessment alongside developing digital skills. The literature on this is quite clear that students often prefer podcast assignments. I say that, but I think our students prefer it once they've done it. They're very terrified before they start it. Then when they're doing it, they're still scared. Then when they've done it, they feel like, I wonder whether it's good. And then they get their marks and go, oh my God. So basically, it's more enjoyable and it's more authentic and it allows greater creativity. Some of the music we get is pretty impressive and it's better for building their confidence as communicators. It can also maybe have a positive influence on knowledge retention and promote deep learning too. And that's some research from Wakefield, Pike and Amici Dargan from 2023. Our external examiner has said they're very impressed and that incorporating the CEOs into the podcast interviews a stroke of brilliance because it bridges hierarchical structures. I think from a student on the programme, the student said that they were really daunted by the idea of the podcast and they were really impressed and surprised by how down-to-earth their chief executive was. And although it was daunted, they managed to exercise lots of key skills not only needed for university, but also in clinical practice, which made them appreciate the assignment and looking at key links to their job role. It gave them practice and insight if they were ever to move into a more managerial position, and they really enjoyed it and felt proud of the piece of work that they'd produced. And they also felt that they were able for the first time to really compare and analyse literature, to use her own voice to explain that had improved her analysis skills, but allowed her to become more confident in academic discussion. And we're going to hear part of her podcast today. So without further ado, I'm going to let Fiona introduce the first podcast.
Thanks, Ali. So The first podcast that we've got today was conducted by Mazeeda and she interviewed her Chief Executive, Martin Hodgson, of East Lancashire Hospitals NHS Trust. So Mazeeda asked two questions, one about organisational culture and the other one about leadership. And we have both of her answers here with a little bit of Mazeeda's analysis of what Martin said.
Thank you. And what qualities do you think make a good leader and why?
Oh, yeah. I think there's a range of stuff, really. I think you need to be authentic. I try to be authentic in all my interactions, whether that be, written communication, sort of team brief, face-to-face interactions. And sometimes that's saying the out stuff, to be honest with you. And I said it's a different operating context now. So I think it's incumbent on leaders to articulate to staff and explain to staff, what we are required to deliver, and it's tough. And, it was ever thus that you had to deliver high quality care, deliver good operational performance, all those targets were held to account on, live within the financial means and the workforce challenges. That is increasingly hard to do, I think, that quadruple aim. But being really open and honest about it and how we have to go about things. But at the same time, I think you've got to engender hope and set a direction and strategies and governance and structures that show that we will get to a better place and it will be less demanding. Obviously, a new government, some money's been announced from
Definitely. And what does organisational work culture look for you? And how do you promote this?
I think it does link to that, authenticity, that open and honest dialogue, and it is right for all colleagues, irrespective of where they were, whatever, job it is, whatever the banding or whatever. I don't really like sort of that hierarchical bit, to have an open and honest sort of dialogue. And it's about continuous learning, really. So I don't have all the answers and all the ideas, and often staff working in their services know how to deliver better, safe, personal, effective care. So it's how you harness that. I think our improvement practice is pivotal in it. So I've seen some really, really good examples, end-of-life care, nutrition, hydration, where we've delivered more effective care, better outcomes, give a better patient experience in a more cost-effective way. But I think we need to industrialize that, we've got a great improvement team, but all staff working on those sort of ideas and those improvement projects to continuously improve, so we deliver high quality care within those really sort of constrained resources. I think, it is right that staff, if they see something, they should say it. And I think we have a numbers of structures now where if people are having a tough time or, that they're not overly happy, where they can raise their concerns. Now that's use of our staff networks. We've got some brilliant staff networks. That's use of the staff guardian, clearly your line manager. And being a line manager is a tough job, to be honest, and it's never been harder. So again, we've put some, development programs in around being, managers. So things like our spec improvement program, Project M, etc. So it's about creating that culture to help people and give people the tools to deliver this really, really hard job. To be honest, everybody's got a hard job.
The increasing demands. The second question that I asked was based on what qualities the chief executive thought made a good leader. His answer was focused on how important it is to be authentic in all aspects of leadership, be it through emails, phone calls, or face-to-face interactions. Tate et al. 2023 found from their studies that authentic leadership and developmental hospital cultures overall lead to improved quality management practices, quality of care, and patient satisfaction, thus resulting in a better interaction with staff members. However, the qualities of a good leader are not only defined as being good at talking, but also being able to follow through on the talk by presenting strategies and plans of action. Aleysha 2015 reiterates that adopting a good strategy and implementing it effectively makes for a better leader than those who have been appointed to say the right thing at the right time. I agree with the chief executive when he says that being authentic and open made him a good leader, but I feel it is equally just as important to be able to address the issues that we are currently facing and tackle them. For example, he mentioned the focus on the winter pressures. I feel that the winter pressures are now year-round, no longer exclusive to just one season. Therefore, addressing the increase in pressures year-round by putting in place strategies to recruit more staff and streamline services would be more beneficial than simply being authentic and open.
Thank you very much, Maz. That was her discussion with her chief executive, Martin Hodgson. And she did really well for that assignment. And now we're going to move on to a different area of the country altogether with Taylor Stroud and his conversation with Dr. Rifat Rashid, Hospital Executive Director for Heartlands Hospital in Birmingham.
Based on your experience within the trust, where do you think the best ideas come from for improvement within our organisation?
The best ideas always come from the people who are doing the job.
Yeah.
That is fundamental truth. And so that is something that I have held on to. It's one of the reasons why I do the job that I do, is that to allow and to enable people who have got the answers to the very difficult challenges and questions that we face, and to give them a platform and to give them the opportunity to realise their ambitions and actually help us as a site to continue to grow.
Dr. Rashid stated the opening question that she believes that the best ideas are generated by those who are working in the areas that require improvement. And I feel like this aligns with what Bevan 2015 suggested, where evidence shows that highly diverse groups of non-experts consistently outperform small groups of experts. So essentially that reads to me that the people that are doing the job are going to be the best people to seek ideas for improvement from. And then individuals such as Dr. Rashid, people in positions of power, can then implement those changes with using a more structured plan, perhaps. Bathello et al. 2017 also suggested that CEOs must have a clear course for their business, and their employees must buy into the person or buy into them as the person to lead the organisation forward. I felt from the very start of our interaction that Dr. Rashid had our organisation's best interest at heart. For instance, she came to personally collect me from the reception. The way she answered my questions, I felt I bought into what she was saying, and that she wasn't just saying it, she genuinely had, in particular, our site's best interest at heart, and that she practices what she preaches.
Thank you, Taylor, for that really insightful interview with your executive director. We're going to move on now to another area of the country, Northumbria, with our student Aleysha Harness, who's interviewing her chief executive, Burju Bartoli, who is the chief executive of Northumbria Healthcare NHS Foundation Trust.
The next question we asked the chief executive was what strategies are in place within the trust to encourage a positive and inclusive work culture.
We do spend an awful lot of time at work. That's part of who we are. So spend an awful lot of time regardless. And I am of the simple mind of, and I don't say this flippantly when I say life is too short to not enjoy every moment. And whilst some people might not get out of bed in the morning and say, woohoo, can't wait, I'm going to work today. When you start to wake up in the morning and you're like, oh God, I've got to go to bed, I've got to go to work, and that dread and that, then I really think we also need to help people to say, you need to do something different. Yeah. Because we really value and we want to make this a great place to work. We want people to feel happy coming to work. We want people to have an environment that is conducive to work. We want them to have good colleagues and teamwork, and we want people to feel fulfilled by what they do, whatever that role might be. We place a lot of emphasis on our staff surveys and telling us, so not only the national staff survey, but also the local ones that we give in real time, because I think that tells us, it gives us a temperature check in terms of how the organisation is just feeling. but also some specifics sometimes about what isn't right. So I think that kind of element of listening to what our staff say is really important, and we want to hear from groups of people that we wouldn't normally hear from. So our staff experience team, Jo McIntosh and her team, deliberately go out and find pockets of staff that we might not be hearing from regularly to try and get their views and make them feel comfortable to give their views. Because I'd rather hear about it than somebody sit unhappy in a corner and nobody has ever said that this is what the problem is. Because if we know about it, we can then do something about it. And I think importantly, even if you can't do something about it, you're upfront and you can say, look, I can try and help with this, this and this, but I can't help you with that. But I'll support you in whatever you want to do, but I can't fix that bit. I think there's something about having a two-way honesty and I believe in that quite strongly. And I think as well, for me, there's a big thing about how we empower staff to feel able to speak their mind. Want to hear the truth. Want staff to feel honest about when things are working, when things aren't working. And I think that engenders as well a bit of a, when I say loyalty to the organisation, a sense of belonging to the organisation. I want people to feel invested. I will openly say, we're only as good as our staff in the organisation. You would.
So what I noticed in this answer is to truly stress the importance of wanting people to enjoy coming to work. This is shown to be important as Charles Aleysha et al. States that there is a positive relationship between a worker's subjective well-being and productivity, and individuals who are happy in work have a better attitude when performing activities and therefore are more productive. She further stated that she wanted to help individuals that dread coming to work and would rather support them in finding something that they enjoy instead of suffering in silence. This is great, as even though losing them would affect the establishment of a service, she still wanted to support people to find something they will enjoy. I noticed she put a huge emphasis on the use of staff survey, as she wants to hear how staff are feeling and if there are any recommendations from the people who are working clinically that she can help implement to support them. Staff surveys have been found by DayWall to be important as they facilitate evidence of if staff are satisfied in their roles and identify areas for improvement, because as the more satisfied they are, they will perform their role with a higher quality, therefore improving the service for both staff and patients, which is clearly her main goal as Chief Executive. She then stressed the importance of hearing from everyone, so much that she will go out and speak to staff in person to get their views, so she's visible within the trust. I think this shows she's an approachable leader. This is key in healthcare, as leadership is important for safety, staff morale and system performance, as found by Swanee and Isherwood. Following on from that, she is also honest and truthful when she can't fix a problem, but will look for alternatives to support people, which I think is great from a management perspective. Lastly, what really impressed me is her stating we are only as good as the staff in the organisation. It really showed that the well-being of her staff is the main priority, as they are the backbone of the organisation, and was really refreshing as a member of staff to hear myself. So
for the second question, Sasha was asked what strategies she implemented and maintained to promote a healthy workplace culture.
I think the biggest thing for me is communication. I think if you don't communicate, the culture within the organisation can easily change. Quite a lot of people feel that they don't know what's going on. I get sort of a bit worried about things, and especially, we've had a lot of changes in the last sort of 6 months within the organisation, changes of leaders and things. And I think that can make people kind of nervous and behave in more difficult ways because they're worried about their job or they're worried. So is that communication, but communicating in different ways to different people. Some people need that one-to-one conversation. Some people, are quite happy with an email.
We're now going to hear from Katie O'Donnell, who is talking to her Chief Operating Officer from Alliance Medical's Sasha Burns.
Workplace culture is important. According to Sonnefeld and Noseworthy, 2016, a negative workplace culture can cause burnout. Drybar et al. 2017 study found that clinician burnout led to medical errors and poor quality of care. Sasha says the best way to maintain a healthy workplace culture is communication.
I'd like to take a really big moment to thank all the students and the people that they interviewed for the podcasts that we really enjoyed listening to. And I hope you've all enjoyed listening to some very short extracts from each one, because each one in the course is 20 minutes. So thank you very much. Our next podcast will be coming out next month.